Well, in this first module, we're going to concentrate on what helps your body function healthily. Now, one of the things that we are going to talk about will be nutraceuticals. And I'm specifically saying nutraceuticals because there is a big difference between a nutraceutical and a supplement. A supplement can be a nutraceutical, and a nutraceutical sometimes can be a supplement. Now, what's the difference? The difference is primarily dosages. Nutraceutical usually are supplements of slightly higher dosage. They are more concentrated, and they are more specific in their action. We use nutraceuticals to help us treat conditions. They are an aid. We are often using nutraceuticals as an aid in conjunction with our other treatments. And the word nutraceutical alone will tell you what it means. Nutra, natural, ceuticals, pharmaceuticals. It's a natural medicine. So in that sense, supplements and nutraceuticals are slightly used in different contexts. You know, earlier on we said nutraceuticals are more concentrated and they have more profound effects and they're used in specific conditions. So these nutraceuticals are primarily, most of them are produced in GMP factories. That means these are factories that make pharmaceuticals for humans. And the GMP factories are those of very high recognized production facilities. And these are important because when we talk about using things in high concentration, in pure forms, we have to make sure there are no adulterations. Because when you're using these things in a chronic fashion, constantly, every day, any adulterations can accumulate. What are adulterations? Well, adulterations are things like mercury, lead, heavy metals, which sometimes creep into the ingredients. GMP factories consistently test every batch for any adulterations before the ingredients are added into the final product. And it's not always possible to get GMP factories to produce everything, but we try as much as possible to do that for most of our products. And so nutraceuticals is an important area where we need to try and make sure that the ingredients at least come from very recognized, respected sources. And GMP factories are one of them. Supplements are very important in companion animals' daily diet. And nutraceuticals are important in animals that are ill or have conditions that require slightly purer forms and high dosages. Now, the reason why we need supplementation in a normal, healthy animal is because we don't have normal, healthy diets. That's the reason. If you want to maintain health, you need healthy diets. But unfortunately, most of our diets today, especially for our companion animals, our fur kids, are produced in a very hurried fashion. And many of them are over-processed. And in this processing procedure, we destroy and adulterate many of the ingredients. An example is commercial diet. All commercial diets are deficient, all of them. All the deficiencies are corrected in the middle of the processing procedure or at the end. They're added on because the high temperature of processing it destroys just about everything. It destroys the protein, it's denatured. It destroys a lot of essential vitamins and minerals. It destroys the enzymes and cofactors. So the final product, after we add into afterwards these minerals and vitamins, is only the minimum for it to be exported or imported into a country. Because every country has a requirement. You have the minimal recommended daily allowance, the RDA. So most commercial diet have just the minimum to satisfy that, because it's expensive when you start adding all this into a food. We are not talking about it. For me, dietary requirements change with age, stress levels, daily stress levels, with pregnancy, with disease. So which is not actually provided with a diet which has only the minimal requirement. So what we need to tell people is these commercial diet are all actually deficient. They only provide the minimal daily requirement. So you really need to look into supplementation. And the supplementation comes in forms of powders and pills, and there are a whole range of supplementations. And if the animal is ill, you need nutraceuticals constantly to keep the animal in optimal health or to help the animal to heal. In addition to what I said before about commercial diets, we should also look at what are we eating today. If the diet is home cooked, for example. Did you know that home cooked vegetables that you buy from the market or supermarket are also highly deficient? Because of our modern farming methods, most of our former farmers just supply a commercial fertilizer. Commercial fertilizers do not have all the trace elements. Most of them only provide nitrogen, phosphorus, and potassium. So this is NPK is deficient in molybdenum, cobalt, selenium, zinc, all which is essential in your metabolic process in your body. They act as catalysts. But our diets are deficient. So what happens? We develop deficiency disease. Deficiency disease is not what we think. They're very subtle. They can occur as skin rashes, gastric upsets, headaches, blurred visions, poor immune system, so which we don't associate with what we eat. So for our fur kids, it's important to realize that even though you make what you think is a balanced diet, it is actually deficient in micronutrients. So that's why it's important to supplement their diet. And if you're keeping birds, feeding them dry bird seeds, how can that be complete or even balanced? Because you need fresh fruits, you need fresh seeds, and they're all very different in components to what is in a packet. So even when you're talking about birds or hamsters or chinchillas eating pellets and dry hay, you must think about supplementation. It often been asked at what age should we start pets on supplements and nutraceuticals, and I said the day they are born. In fact, before they're born, the pregnant animals should be started on nutraceuticals and supplementation to give the best chance of survival of the young ones when they're born. So when they're born, you should give them a balanced diet, and that is not sufficient. You must supplement the diet right from the day they're born. How? By giving them, if they're still suckling, you make sure the mother is given supplementation so it comes through the milk, so that all the goodness comes through the milk to the young suckling fur kid. Once the fur kid is weaned, it's on a proper diet, you must also supplement, because as I said earlier, all diets are deficient. You must supplement. You know, fortunately, most of the nutraceuticals that I recommend don't take a long time to work. And usually within weeks or months, for some of them, for many of them, the results are very evident. And because there are supplements and nutraceuticals, for supplements, the results might take a bit longer. It might take months or even years for it to kick in. And sometimes for supplements, the results are much more subtle. As I said, if you're deficient, the deficiency is not seen. They're not that obvious. And so the effects are also not that obvious when you supplement them or even give them a nutraceutical. A good example would be skin problem or immune system problem. You do not see it straight away unless there's a challenge. For example, if an animal has been taking a nutraceutical or a supplement for immunity, and it might be years later when it falls ill that you realize that it's actually working, because his illness will be circumvented, it's shorter, his recovery time, he heals faster after surgery. And these are all things that you don't see early on. So when I hear some of people saying, I'm going to give it a try, I don't know what that means, because sometimes the evidence is not so obvious. It's much more subtle. You're not going to see any changes. But obviously for certain illnesses, you will see very quick changes when you give nutraceuticals. Things would be coat condition. If you use a good nutraceutical, you will see the skin and the coat improves very quickly. Or when you look at eye, sometimes the nutraceuticals for eyes will give you profound effects in a very, very short time. So one of the other conditions that you see quite rapid improvements if you're using a nutraceutical would be on gastrointestinal problems. You will see some marked improvement, for example, diarrhea or gastritis or pancreatitis. And some of the other marked improvements you see when you use an appropriate nutraceutical will be in joint problems. You will see marked improvement in the way they walk. You will see marked improvement in the way they get up from rest. So yes, but most of the nutraceutical effects on an animal which is not overtly ill or obviously ill will be very subtle, unless, as I said earlier on, they're challenged, and then you will see the obvious effects. I mentioned earlier in my other module on nutrition that all processed food, even all natural foods are deficient, and all animals will benefit from supplementation, including hamsters, rabbits, birds, chinchillas, and for that matter, even humans. The owners themselves will benefit in supplementation, because whatever we eat today are totally corrupted, insufficient, deficient, and sometimes imbalanced. You know, one of the things that is the most major thing that is important for overall animal health from the time you're born, and that's the immune system. The immune system is responsible for 100% of your animal health, of your pet's health, and for that matter, your own health. And the immune system occurs in two parts. When you're born, your immune system is called the innate immune system. You're born with it. And then as you get older, when you get in contact with the environment, with germs, through vaccinations, through your mother's milk, these are called acquired immune system. Both of these work hand in hand. They play different roles in the immunity of your body, and together they keep you in good health. So this immune system, the one you're born with, which is your innate immune system, and the acquired immune system is the one you get through food, through vaccinations, through the environment, can be compromised. You could imagine that if you are on the wrong diet or you're under a lot of stress, your acquired immune system will suffer. Your innate immune system, of course, will kick in to try and help you. But as I said earlier, they play different roles, and your body needs both of them to have optimum immunity. So during your life, or during the life of your fur kid, if they're given a deficient diet, if they're under a lot of stress, if they're not looked after properly, they're not given proper water to drink, they're not given adequate food, they're not given a balanced diet, they're not given any supplementation, the acquired immune system will be badly affected, and they will fall ill very easily, or they will develop all sorts of problems that may initially look unrelated, but every disease in the body is related back to the immune system. So treatment for all diseases actually start with also treating the immune system. Treatment of many of the immune system problems we have today starts at a process called immunomodulation. Now, what is immunomodulation? It's a term that was never taught at university. All doctors and veterinarians are never given this word, but today it's becoming more and more important because we realize the importance of the immune system. For example, in the treatment of cancer, we are now looking at immunotherapy. In the past, we never talk about the immune system. We forget that vaccination is also part of immunotherapy, but we never use that word. So when we talk about immunomodulation, what does it actually mean? Immunomodulation is where the immune system is very low, we boost it up. When the immune system is very high, we suppress it down, but we're not completely suppressing it, or we're not completely boosting it to a high level. Immunomodulation is where we are balancing the immune system. When it's too low, we bring it up to a certain level. When it's too high, we bring it down to a certain level, so our immune system in the body is in harmony, is in balance. That is called immunomodulation. And the therapy that we use today when we treat the immune system is called immunomodulation. Well, as a veterinarian in therapy, I'm constantly aware of this immunomodulation, which I need to be conscious of. And we need to be conscious of the immune system every time an animal is treated for a specific condition like skin problem. For example, animals that come in with mange. Mange is a parasite that lives in the follicles of the hair. And these conditions occur in dogs that are immunocompromised when the immune system is poor. We know that. We know that as a scientific fact because the skin contains these mites in healthy dogs. In healthy dogs, if you scrape the skin, 35% of dogs you will find these demodectic mites. Now, why do they develop into a problem? Because when the minute the immune system is compromised through pregnancy or poor nutrition, these mites start to overgrow. They will develop into a skin problem that is noticeable. In a healthy animal, you don't see any of this because they are contained by the immune system. So in the treatment of these animals, not do we actually to try and kill the parasites through the use of ectoparasitics. We also try and improve the immune system of the animals by giving them high-dose vitamin C, sometimes by injection, or other forms of immunotherapy. Another example, as a horse vet before, as a horse practitioner, when I treat animals, horses with severe pneumonia, sometimes they get this. When the immune system is poor, they get dust from the oats, from all of that getting into the lungs, and they develop a secondary pneumonia. And what we do for these horses, we give them concurrently with the antibiotics, we give them immunotherapy. The immunotherapy is an injection, and in the past we were using a product called Equistim or immunoregulin, and this has been very useful to help in helping the immunity, improve the immunity of the horse, so that they can overcome their respiratory problem. Giving antibiotics is just not good enough. So another example in small animals, when we're treating them for long-term skin problems, some of us use high-dose antibiotics for long periods of time. We suddenly realize by doing that, we are compromising the immune system, because the immune system in the gastrointestinal tract is provided primarily 70 to 80% by beneficial bacteria that is present there. When you give them oral antibiotics over a long period of time, you're effectively sterilizing the gut. So by sterilizing the gastrointestinal tract, you are actually sometimes dooming these animals to further problems, immune system problems that will come out later that you may not even plan for. So when we're treating animals with antibiotics, I'm acutely aware that we need to also be giving them, after the fact, high doses of probiotics. And sometimes we even use feces of animals to treat them, because feces contain the whole complex group of probiotics that are of beneficial bacteria, which is sometimes not found off the shelf in commercial probiotics. So this is another reason why when we treat animals, immunomodulation is so important that we do not compromise it further. That every disease that we see in animals, as I said earlier, involves the immune system. And we need to be constantly modulating the immune system in all diseases. So whether it be treating for cancer, whether it be treating for an infection, whether it be treating for a simple skin problem, we need to be constantly aware that we do not damage the immune system. That sometimes we need to actually improve the immune system to give us added benefits of our therapies. For thousands of years, the ancient Chinese have discovered that there are many beneficial health benefits in consuming certain mushrooms. The Chinese and the Japanese, in Japan, the reishi, maitake, in China, lingzhi, sanghuang. All these mushrooms have incredible healing properties. In fact, in the old Chinese pharmacopoeia, ancient pharmacopoeia, the Chinese medical texts, the longevity herb is actually a mushroom. And this is the sanghuang mushroom. And only recently, over the years, we found that one of the important ingredients, not all, but just one of the important ingredients in many mushrooms that gives you health benefits is beta-glucan. And beta-glucan is found in many, many mushrooms. It is the most commonly used ingredient in promoting health in stimulating the immune system. That's a function of, that's what it does. We have found that in many, many experiments that beta-glucan actually stimulates immunity. But the beta-glucan that is found in different types of mushrooms vary. And in fact, beta-glucan is also found in oats. But because they vary in structure, they're all sugars by the way. Beta-glucan can occur in liquid, solids, or as a powder. Depends on how you want to prepare it. And it can change between the three depending on temperature and humidity and all that. It doesn't mean the sugar has gone off if it appears in a liquid form, or it doesn't mean the sugar has lost its property because it's solid. They all maintain, as long as they maintain the structure. Now, various beta-glucan, the beta is a chemical name, it's a chemical structure of this particular sugar. The glucan meaning the sugar. The beta is a specific chemical sugar structure. But the size varies, the molecules vary in different mushrooms. So you can get various types of effects, from the very intense effect, very good effects, to the very weak effects found in oat. So oat has very low immune stimulating effects. So the very highest stimulating effects in experiments done is found in the Sanghuang species, the Phyllenius, particularly the Phyllenius lincteus species, that has the strongest immune boosting effects of that specific beta-glucan. So the molecule size is also important. So my company, Pet Health Global, has found a very effective beta-glucan from a specific yeast. And this beta-glucan is has proven to be scientifically very effective. It is a very large molecule, it's a very effective molecule size. But unfortunately, because it's a very concentrated, large molecule sugar, it attracts water very easily. So sometimes it's liquid or slightly liquid if you leave it out and open long enough. And if it attracts a little bit of moisture during the production process, sometimes it just hardens in the capsule. But of course, most of us like to see it as a powder. And this is the one we use in our product, immune modulator. You know, there are 5 main diseases that come to mind. As a veterinarian, over the 45 years I've seen. And number one in the list of frequency, the first is actually cancer. We see a lot more cancers. The second one would be heart disease. And the third one will be liver, followed by kidney, and followed by joint problems. And unfortunately, over the 45 years, there has not been a downward trend, despite the fact we have come up with better management, better drug management, better surgical corrections, better treatment protocols. These diseases are on the climb. They're really not on the decline. So cancer is probably, in my practice, the number 1 killer. I see it every day. I used to see it occasionally, but now I see it every day. And it's not because we detect it more, because many of these cancers are so obvious. It's not like you need special equipment to actually find them. They're really, really obvious cancers. We see a lot more of these. And unfortunately, our treatments have not caught up. We have not caught up with these diseases, and we're still having quite dismal results in their treatment. You know, these are called chronic degenerative conditions. They occur in humans as well, probably about the same frequency as animals. And the one thing in common we have today with most pets is what they eat. I think, you know, management of chronic degenerative diseases starts off with prevention rather than treatment. I think prevention comes in the form of good, balanced, healthy nutrition, fresh foods, less processed stuff, less treats. Treats are one of the biggest culprits in my practice that I see, causing a lot of problems. And we need to be constantly aware that, because I have said earlier, all foods today, whether fresh or commercialized, are deficient. We must supplement. People say, well, my company just does nutraceuticals. You can use a nutraceutical as a supplement. The difference with that, I said earlier, is in purity and dose. You just give less. Smaller dose, prevention. Higher dose, treatment. As I said, vice versa. You can use supplements for treatment, use a bigger dose. So in the treatment of these diseases, well, allopathic medicine is what I graduated in. That's as a normal doctor. We have many ways to treat them as well. But of course, if we combine our treatment with nutraceuticals, dietary management, we get much better results. Much better results. For example, in cancer, we do not have a cure for cancer today. No one has. But what we can do is we can manage cancer so the patient lives longer, healthier, happier during the period of time he's alive. So we know, for example, in cancer treatment, there are some very good cancer treatments out there that utilizes immunotherapy, that utilizes low-dose chemo. And we have a lot of oncologists around now that practice this. They practice very good targeted therapies for cancers. And that's what human doctors are doing as well. They are moving slowly towards immunotherapy. They are moving towards targeted chemotherapy. And these are the things that will ultimately give us better results. And then they're proving to be much more effective. And in combination with proper nutrition, weight management, proper sleep, proper rest, I think we can have a better way of managing cancers. And in fact, we know a lot more about cancers today than we did before. In the past, we used to say, well, we don't know why cancers occur. Nowadays, we do. Cancer is a disease of the immune system. We know that. We are producing cancer cells every day. The reason we do not get cancer is because we have a very strong immune system. Our immune system will very quickly take out any cells that are abnormal or mutating. But cancer comes in when your immune system is compromised, and that comes in through stress, poor nutrition, excess exposures to chemicals, exposures to radiation, exposures to toxins, exposures to certain types of fungi, bacteria. These can lead to cancers. So any abnormalities, any abnormal exposures over long periods of time to these abnormal environments can lead to cancer. So because we know that, it starts with prevention. We know that bad nutrition can cause poor immunity. Poor immunity can lead to cancer onset. So we can start with what we put into the mouth of our fur kids. As I said earlier, we need to be constantly aware of what we are feeding them, because we can either make ourselves extremely happy by giving them loads of treats, loads of sugars, makes us happy to see them happy, but we condemn them to a life of misery later on. And we shorten their lifespan. I think what needs to be said now, when you have a companion animal, your fur kids, the most important thing is you need to respect them. Even if you don't respect yourself, I think you need to respect them. They are not you. You can abuse yourself, you can do all sorts of things. But I think these are animals that don't speak. They cannot express themselves. you have a responsibility to respect them. Well, in the same way we can prevent and also manage diseases, like I said before when we talked about cancers, we can still use chemotherapy, we can still go and see an oncologist, but I think nutrition and nutraceuticals play a big part in management. Same with liver disease, for example. We can manage liver disease by eating right, because liver disease comes from food. It doesn't develop on its own unless it's an inherited problem. The majority of liver disease comes from what we feed, poor companion animals. A diet too high in fat and sugars. A diet very high in preservatives and chemicals. A diet that is devoid of certain nutrients which are essential for normal liver development and health will lead to liver disease in the long run. So some of the important nutrients and supplements we can give for liver disease will be things like dandelion, which is milk thistle. Silymarin is the active ingredient. Comes in many forms. We name them differently for different markets. For the medical market, we call it hepavite, but it's the same thing. So silymarin is a very important herb, which is found in nature, and this is very useful in treatment of liver disease. And some of the nutrients that are important in liver disease will be choline. Choline is excreted primarily in your bile and helps as an antioxidant, helps in the reduction process, in the metabolic chemical reactions in the liver, choline. And the other one is glutathione. Glutathione is a very important antioxidant produced by the liver. And glutathione is extremely important in the normal functioning of the liver. And it's excreted in large amounts in the bile as well. So all of these are important in preserving the structure of the liver. And other ingredients that are important in liver health will be methionine and B complex. B12 is very important in liver disease. And in fact, when there's liver disease, B12 is actually deficient. And deficiencies in B12 can lead to all sorts of problems, including anemia, red blood cell production, appetite. All of that is very, very important. And in most liver diseases, there is a lot of scarring. And scarring in liver disease can be reduced by many of the supplements we talked about before. And antioxidants, such as alpha-lipoic acid, which is very, very important in the fact that it is actually a fat transporter. And this fat transporter is very, very important in the transportation of fat in and out of cells of the liver. And this alone in high amounts can actually prevent a lot of fatty liver disease. And exogenous amounts of alpha-lipoic acid is extremely safe. Same with some of the many pre-mentioned ingredients that we talked about. So liver disease as a whole can be prevented by a good balanced diet, low in fat, low in sugar, low in chemicals, and high in supplementation of some of these things I mentioned. And of course, we need to also mention that liver disease can be also caused by drugs. So there are a lot of drugs we need to be very, very careful of in giving large amounts. And one of it would be antibiotics. High-dose antibiotics actually suppress your immune system, interferes in the normal metabolism of the liver. And the liver is the main organ where all toxins are removed from the body. They have to be metabolized through the liver before we remove traces of any poison. And antibiotics is a poison. That's how it kills bacteria. We need to remember that. We forget that. We treat it like this tiger balm. Cures everything from carbuncles to cancer. We use it in very high doses. We use it for just about everything, whether it's a fever, no fever. It's always, we use it out of fear, just in case. As a veterinarian, that's what a lot of veterinarians do. Just in case we give it. Just in case we use high amounts. I mean, there are prices to pay. And unfortunately, the patient pays the price. Not only the amount you pay out in dollars and cents, but in the normal healthy welfare of the patient. So we need to remember toxins can be anything that's given outside the body. Preservatives, coloring, flavoring are also toxins. We find that in treats. We delight in giving dogs treats. They're attracted to it because they're abnormally sweet or abnormally flavorsome, because these are abnormal chemicals we add to it. You can take anything you like. Take a piece of meat, dry it out. You think it's tasty? No, has no smell. How do we make it tasty? We add nitrates to it. We add sugars or we add salts. Is that healthy? No. Why do we do it? Well, I don't know. We seem to delight out of making our pets happy because they're eating all of this. Would you give that to your child on daily basis? Most parents would say no. So why are you doing it to your pet? Don't you know it's bad? And we think it's healthy because, it can't be unhealthy because they all look green or they look red or they look pink. These are colorings. When you dry something out, it loses its color. You cannot believe that things on the shelf are that because it is healthy. There are a lot of things that are green, which is actually not green because they're healthy. They're green because the coloring you put in. So there's an organ in your body that needs to get rid of it. It's your liver. Well, not necessarily your liver, but the liver of your pets. Can we stop doing this? Can we respect them? If you really think you need to give it, then you take it. You give it to yourself long term. You experiment with it and see whether there's a problem. That's why I always tell people who keep these pets, you think it's good? Well, why are you not eating it? Well, we often in the past just talk about probiotics, but recently at least in the last 10 years, there has been a lot more talk about prebiotics. I think most of the general public don't quite understand this. So I'm going to explain it to you. A prebiotic is something you would give with a probiotic. Now, what is a prebiotic? A prebiotic is not a bacteria. A prebiotic is actually a starch. It's a food that feeds bacteria. And a very important food that feeds bacteria is actually a soluble starch. These are called soluble fibers. These are starches that provide energy, that helps the bacteria to grow, keeps them alive and healthy in your gut. So soluble fibers are starches. They are clear, they actually dissolve. You'll see that when you cut a piece of papaya, when it drains out, you put it in the fridge, you get this clear jelly at the bottom of the papaya. That is a soluble starch. That is a prebiotic. So you find prebiotics in all sorts of plants, all sorts of fruits, and the prebiotics are as important as probiotics because if you don't give enough prebiotics, soluble fibers, the bacteria don't grow very well, so they're constantly flushed out. You take it, they don't live very well, they don't multiply, they're flushed out. So you also have a lot of good bacteria sitting in your gut, which is called the microbiome. All these combined colonies, varieties of bacteria that's in the gastrointestinal tract of all animals constitute the microbiome. The microbiome, for them to grow and maintain health, you need a lot of prebiotics. And prebiotics, as I said, are starches. You do not find that in meats. You do not find them in sugars. You do not find them in many of the stuff in treats. You do not find them in coloring, flavoring, preservatives. So you would actually find them mainly primarily in plants and fruits. So it's important, that's why we say when you want a healthy gut, you need to eat a lot of fruits and plants. You cannot maintain health just by eating protein. Protein is there for only one function. And there are many functions in your body that requires other things. So proteins are important in your muscle, in your antibodies, in those single function where protein is required. But then you need other things. Prebiotics are absolutely required for a healthy gastrointestinal tract. Probiotics are bacteria that are healthy for you. They are beneficial bacteria. They're found all over your body and inside your body. So they're found in your skin, they're found in your oral cavity, they're found in your dentine. They go all the way down the gastrointestinal tract, all the way up through to the anus. Because you have to remember, probiotics are superficial bacteria. Your skin invaginates to your mouth and out through the anus. It's all one piece, actually. So all the bacteria that helps in your body function that's found on your epidermis, which invaginates into your gastrointestinal tract, are called probiotics. These are healthy bacteria. They maintain a state of health. This is part of your acquired immunity. Your microbiome is part of your acquired immunity. You cannot talk about probiotics in a different breath to your acquired immunity. They are part of it. In fact, 60 to 70% of acquired immunity resides in the microbiome, in the probiotics. And the microbiome, we realize today, is so important that if you get rid of it, you open yourself to invasion by fungi, by bad bacteria, by viruses. In fact, if you take a laboratory animal and rid them of the complete microbiome, we have them, we grow them in the laboratory. They have no bacteria on them. They're completely sterile. We grow them for research. They are very prone to every disease you can think of. So it's so important, but we're giving it so little importance in our daily lives. And in our medical treatments, we completely ignore probiotics. And when we talk about probiotics, we only think about a few that are commercially available to us as consumers and as veterinarians. And we think that's it. That's not it. It's more than just that. You know, we have a product because over the years we found that most of the probiotics on the shelf that you buy, first of all, most of them are dead. We did tests on a lot of them. 70% of them are dead. So you're actually paying for nothing. They have to be alive to work. And the second thing we found that there are only a few species that are sold on the supermarket shelf or in the pet shop or by the vets. There's only a few species. And in your gastrointestinal tract, there are 300 over species of bacteria, of which there are scores of bacteria that are beneficial for you. And these beneficial bacteria cannot be replaced completely just by taking probiotics off the shelf. So we came up with, and also the other thing about probiotics on the shelf is a lot of probiotics that are sold on the shelf are from milk cultures. And if you have a patient that has a dairy intolerance, traces of dairy products in these probiotics can cause vomiting and diarrhea actually. So we need to be very, very careful. And we need to go beyond that when we come to treatment. How do we help a patient with gastrointestinal problem, with immunity problem, by replacing just a few bacteria? So we came up with a bacteria which is actually found in the gastrointestinal tract of mammals. and there's Enterococcus species, and the one we have in superbiolite is Enterococcus faecium. And Enterococcus faecium is one of the bacteria we have in superbiolite, which is very, very important in the gut, plays a very important role in gut health. But as I said, it's only another species. But this will top up the other species you can get through other probiotics that you're getting off the shelf. And this one is alive, and we guarantee that it's alive. And that's why we need to grow it. We need to actually incubate it for at least half an hour to an hour or more to get the numbers we're looking for before we consume it. Now we found that because superbiolite was produced primarily for gastrointestinal health, a lot of animals who suffer from vomiting and diarrhea have damaged intestines, intestinal linings. That's why they bleed sometimes. And they are denuded of mucus. The mucus is a protective lining that are produced by lining cells to protect the epithelium of the gastrointestinal tract, the lining of the intestinal tract. But when they have diarrhea, all this mucus is taken out. So we need to in order to promote the regeneration of these damaged mucoid cells and to promote the production of more mucus and to also help heal some of the damaged cells in the lining, we came up with a product which is an extract of immune cells. And this product is called, in our gastrointestinal preparation, is called ImmunoXT. It contains at least 21 growth factors. Once the probiotic has grown to a certain number that you wish, then you add in a few drops of the ImmunoXT. So when it's consumed, it starts working from your oral cavity all the way down to your large intestine. It starts healing all the damaged cells. And that's why we use it in our gastrointestinal product. That was a question that was posed to me many years ago, that can ImmunoXT be used in birds and reptiles? I haven't done any clinical trials on these, but we have tried it with some of our conservation groups here for lizards and frogs and birds that have gastrointestinal problems, or they have been on antibiotics for a long period of time and they're really sick. And it seems to have a lot of beneficial effects for these animals. In fact, we have saved a lot of these animals just by introduction of our probiotics and ImmunoXT. So of course, it requires a lot more clinical trials and experiments, but just anecdotally, we don't see any harm in giving it. And in fact, we see a lot of beneficial effects of this. So yes, I would say that we can use it in other species other than cats and dogs. Now, as part of this discussion on probiotics and intestinal health, we need to concentrate on the first part of the gastrointestinal tract, which is your mouth. You know, I mean, there are a lot of products out there that make a lot of claims, a lot of dental pastes, chewies, dental chewies, and all this claim that if you take it long enough, you have maintained oral health. But that's not true. Veterinarians will tell you, you open the mouth of a dog and the first thing you see would be dental tartar, gingivitis, and then you ask questions, but the owner will swear that it's been given, he brushes the teeth once a week or once a day, and they give them dental chewies. So what is the problem? We used to blame it on consistency of diet. It must be hard, something to chew on, otherwise they get dental tartar. We now find that not to be true, because there are a lot of animals that don't chew on hard stuff. But they have good oral health. A good example will be some of the animals that are constantly being fed a soft diet. Like a lot of us animals on soft diet, kittens, puppies, they cannot take hard stuff, they're on soft diet. And in fact, if you look at a dog when he's eating, he really doesn't chew. They just swallow. So where's the chewing? Oh, we give them dental bones, we give them this. Well, what about animals that don't take dental bones but got healthy oral hygiene? So what would you say? How would you counteract that? And in my experience, 45 years, I've seen thousands of animals that can make a better judgment than most people can. I see really bad oral health in animals that are brushed, that are eating dental chewies. So what is the problem? The problem is this. When you eat foods that you have allergies to, that you have problems with, and which we don't recognize sometimes, it causes inflammation, oral inflammation. And oral inflammation is the first that happens, not dental tartar. Because of oral inflammation, the saliva changes. The white blood cells that are in your oral cavity doing all the work, killing all the bad bacteria that grows there because of increased sugars in our foods, increased fats, and the wrong type of diet, and inflammation, leaves behind residues. Your saliva also produces a lot of protein byproducts in an allergy, which also stains and lives and stains in your teeth. And this supports a whole colony of different bacteria, the bacteria that causes plaque. And when plaque gets very thick, it's called tartar. And these bacteria are not so easily gotten rid of just by chewing hard stuff or by brushing. It's not so simple. Because if you take an example, wild animals, who runs around brushing their teeth? Do they have the same dental problem we have in companion animals? No. I was a zoo vet. For many, many years, 15 years of my life, I've been looking at zoo animals. Dental problems are not that common unless we start feeding them processed food. Then we start seeing a problem. We see problems in animals fed on processed food. So what is the problem? Processed food produces a lot of inflammation. It's actually pro-inflammatory. It's pro-inflammation. So we need to be very, very careful when we talk about this. It's inflammation in the mouth that leads to dental tartar and all that, and bad hygiene. Because of all the bad colonies of bacteria that we actually support in there from the inflammation due to the bad proteins in there, the increased sugars and all of that from processed food. So what do? Brushing doesn't help. Increase hardness of the food doesn't help because most animals just swallow. Giving them a bone or a nylon or a piece of nylon doesn't always help. And in fact, it sometimes endangers them if they swallow it by accident. So we have a way. One of the things is, why don't we think of getting rid of the bad bacteria that causes plaque? Surely that, and dental paste does not do that, because animal dental paste contains a lot of sugars and flavoring. They have to, otherwise you can't use it in the mouth of a dog. So what do? So we have a dilemma, but the dilemma can be solved. There's a new thinking coming on the horizon for dentists. It's putting probiotics in the mouth. By brushing probiotics, friendly bacteria, putting them brushing them on the teeth, installing them in the oral cavity. Surely that would work, and it does. So if you have good bacteria colonizing the mouth or staying in there long enough that the bad bacteria haven't got a chance to grow in there, you have less incidence of plaque. When you have less incidence of plaque, you don't have that much dental tartar. And also when you have less incidence of plaque, that means you have less sugars in there. Surely you have less dental caries. It all stands to reason. So what did we do? We did an experiment with over 100 dogs. We came up with a probiotic that stays alive long in the mouth, and it's Lactobacillus plantarum. And Lactobacillus plantarum lives in the mouth for hours before the act of digestion and drinking flushes them away. And we also know that we can also add charcoal. It's a better dental paste than dental paste. In the old days, brushing of teeth we use charcoal. Charcoal and sodium bicarbonate or salt. That was the original dental paste, and it worked. So we're going back to that thinking. Adding charcoal to it, first of all, charcoal does two things. One, activated charcoal absorbs all the toxins that is produced in the mouth. Secondly, activated charcoal whitens teeth, whitens the enamel. It absorbs toxins, whitens the enamel, and is slightly abrasive. So you can use this mild abrasive effect to brush it on, to get rid of anything that's hardened on. Even if you don't, just by colonizing the mouth with good bacteria, the plaques, a lot of plaque starts to loosen off. So dental tartar becomes very soft. And when we come to dental scaling these dogs, they come off so much easier than something that's concreted on by years of bad food. So probiotics is the way we're heading, and there's no harm in probiotics. And then the question is, how do we know it works? Well, after a few months of using it, just look into the mouth of a dog. It's cleaner, it's whiter, and the tartar is softer. It cracks off very easily. In fact, just using a rough towel in the mouth, you can break off a lot of it, or using your fingernails to scrape it off. The vet will remark how much easier it is to remove it, and you don't get any more new tartar compiling. And not only that, within 24-48 hours of using this product, the Super Biolite, with good bacteria in there, the absence of bad bacteria, and the presence of charcoal, the breath sweetens up. There is no more bad breath, just within 24-48 hours. Very quick. The results in this particular instance is very quick. And constant use of it, you don't get any more new tartar growing. And there's lack of inflammation of the gums. Gingivitis, you reduce gingivitis naturally. So we're heading down the right track. I know that. After using it in hundreds and hundreds of animals, we're getting very, very good results. And if you are one of those using it, send us your comments. Send us if it is working well for your fur kid. Let us know so that we can actually tell others about it.